Hello, and thank you for joining me for this presentation on calf wellness and respiratory disease in dairy calves. My name is Elad Ben-Ezra, and I'm a veterinarian with Zoetis Canada and part of a dairy team that's committed to promoting the health and wellness of dairy calves. The theme of this presentation is a future with full bottles, because when we put the care and attention into our dairy calves to ensure that they're healthy and free of respiratory disease, we're going to be rewarded with a future of greater dairy production. So we know that the first 2 months of a heifer's life are a critically important period. It really lays the foundation for her long-term health and productivity when she joins the milking herd. There's a direct link between heifer growth rates during the first few months of life and age of first calving, milk production in her first and second lactation, and her longevity in the dairy herd. So if we're able to keep calves healthy and growing well during this critical time, we can make a positive impact on these three important outcomes. So here's an example that demonstrates the relationship between average daily gain and first lactation milk production. On the bottom of this graph, we have average daily gain of calves that were between 17 and 65 days of age, and their range of average daily gain, which is from about 0.3 kilograms, or about 2/3 of a pound a day, to over 1 kilogram, or over 2 pounds per day. And on the vertical axis, we have first lactation milk production. We can see here that there's a positive relationship. The higher the average daily gain of a young heifer calf, the higher her first lactation milk production is. So in order to ensure your heifers achieve their full genetic potential, optimal pre-weaning growth rates are really important. And what factors influence these growth rates? Well, nutrition, first of all, and also optimal health, because a sick calf will certainly suffer from lower growth rates, among other issues. In this presentation today, I'll be focusing on optimal calf health. So what are some of the things we can do to keep our calves as healthy as possible? This presentation will be divided into three main categories. First, we'll look at the impact of bovine respiratory disease, or BRD, on dairy calves. We'll then go into some of the immune system challenges young calves are facing. And finally, we'll look at how to optimize immunization to ensure healthy heifers so we can prevent BRD. Let's start with the impacts of bovine respiratory disease on dairy calves. BRD is a multifactorial disease, which means there typically isn't one single cause. Factors such as nutrition, vaccination status, ventilation, commingling of different aged calves, and failure of passive immunity or insufficient colostrum intake can all contribute. To illustrate how respiratory disease occurs in calves, let's first look at a healthy calf's respiratory tract. The red and yellow stars represent the various bacteria that can cause pneumonia: Mannheimia hemolytica, Pastorella maltosida, and Histophilus somni. These bacteria are normal inhabitants of the upper respiratory tract, which means they can be found in healthy animals. They live in this upper respiratory tract, and a calf's normal immune system defenses like coughing and the movement of the cilia or fine hairs lining the trachea and mucous membrane barriers keep things like bacteria from entering the lungs, where they can cause pneumonia. In a sick calf, however, we typically see some sort of stressor occur that weakens the calf's immune system. Then an infection can develop from respiratory viruses, which are shown here in green. These viruses include IBR, infectious bovine rhinotracheitis, PI3, or parainfluenza type 3, BRSV, bovine respiratory syncytial virus, and BVD, bovine viral diarrhea virus. Following infection by one or more of these viruses, the respiratory immune defenses are weakened and will no longer be able to keep the lungs free of bacteria. Bacteria can then make their way down to the lungs and cause pneumonia. Of the respiratory viruses I just referred to, one is of particular importance for calves, and that's BRSV, or bovine respiratory syncytial virus. This virus is the primary cause of bovine respiratory disease during the calf's first year of life. Its prevalence is very high. Recent studies show that up to 70% of animals may be exposed to BRSV before they reach breeding age. And as I mentioned, viral infection often occurs first in the process of bovine respiratory disease. And when BRSV does, it disrupts the mucosal barrier, leaving calves vulnerable to secondary bacterial infection. So how does respiratory disease affect the productivity of your dairy heifers? Well, it does so in a number of really important ways. It leads to higher mortality risk, reduced growth rates, an increased age of first calving, a greater probability of a difficult first calving, and decreased milk production. All of these obviously have real economic impacts on your dairy. We can also look at the impact of lung lesions on dairy calves, because not all lung damage will show itself as respiratory disease. Recent studies here in Canada have shown that many calves can have lesions or damage to their lungs, referred to as consolidation, without necessarily showing symptoms of pneumonia. And studies have also shown that heifers with lung consolidation will produce less milk than their healthy counterparts. And when we consider this from an economic perspective, a study found that heifers with respiratory disease produced 525 kilograms less milk during their first lactation compared with heifers that had no lesions. So there are real economic consequences of this. So let's consider the rates of pneumonia in our dairy calves here in Canada. In a study from Ontario, they looked at treatment rates of heifers under 3 months of age and found that 22% of calves had been treated for pneumonia. So over 1 in 5 calves had been treated for pneumonia before they were 3 months of age. However, another study, also done in Ontario, followed heifers until weaning and found that 57% of heifers actually had lung lesions, not necessarily having noticeable respiratory disease, but they had lung damage that resulted in substantial loss of milk production without showing any symptoms of illness. So the question then becomes, how do we know if a calf has BRD? Well, there are certainly a few ways we can diagnose BRD. One example is this respiratory disease scoring chart from the University of California, Davis. Here you consider eye and nasal discharge, as well as ear droop or head tilt, as well as a few other factors, and come up with an overall score that can be used to diagnose BRD. You may be familiar with this chart or similar ones, and your veterinarian can certainly work with you to provide resources to help you diagnose respiratory disease on farm. But there are also other ways of diagnosing BRD in calves. Your vet can recommend other methods, such as lung ultrasound or other diagnostic tests. Here we see a vet looking for lung lesions on an ultrasound, or they may use a nasopharyngeal swab pictured here to look for viruses or bacteria that cause BRD. It's certainly important to speak with your herd veterinarian about creating a specific protocol for your herd to prevent and treat BRD. So to review our key points on bovine respiratory disease in dairy heifers, BRSV, or bovine respiratory syncytial virus, is the primary cause of BRD during a calf's first year of life. BRD has a number of serious negative impacts on replacement animals. And finally, your herd veterinarian can help you diagnose and prevent BRD. In this next section of our presentation, we'll focus on prevention of BRD because we certainly want to be preventing it rather than treating it. But before we get too far into this topic, I want to set the stage with some definitions and challenge you to adopt a new mindset. We often take vaccinations for granted and consider it to be a bit of a chore. And when we do that, we don't necessarily stop to think about what we're trying to achieve. When we talk about vaccinating, we're simply talking about the act of giving an injection or squirting something up the animal's nose or down its mouth. The end goal, however, is that we want to achieve proper immunization of that animal. Immunization is the process by which an individual's immune system becomes fortified against an infectious agent. And a calf starts to gain immunity in the very first minutes of her life through colostrum. When colostrum is given, the calf is passively transferred immunity by ingesting antibodies in the colostrum, and in this way starts to develop immunity. In addition, when the calf comes into contact with pathogens in her environment, this triggers her immune system to defend against it, which is also a process of immunization. However, as we all know, sometimes their immune system can become overwhelmed and natural exposure can result in disease, which is why vaccination, whenever possible, is the preferred method to immunize. In the image here on the right, we have vaccination depicted by an injection, that's indicated by the blue dots in this image, or intranasally via the nostrils and indicated by the green dots in the image. Now that we've covered those definitions, we also have to consider the challenges facing the young calf's immune system, because there are different aspects in young calves compared to adult cows that change how we need to approach immunization. The first obstacle is that calves are born without antibodies needed to protect them from disease. In cattle, the placenta blocks the transfer of antibodies between the dam and the calf, antibodies being represented by the Ys in this diagram. So there's no transfer of immunity to the fetus. A newborn calf will not have any protective levels of antibodies in its system. Instead, the calf gets maternal antibodies by ingesting colostrum, which contains high concentrations of maternal antibodies, among other important bioactive compounds. So to ensure this passive transfer of antibodies from the dam to the calf, the calf must ingest colostrum, ideally within the first few hours of life. There are many, many essential benefits associated with successful passive transfer of immunity. By administering high-quality colostrum to your calves at the right time in the right amount, you reduce your calf treatment and mortality rates. You'll see improved growth rates and feed conversion, and have a younger age of first calving, as well as seeing increased milk production in the first and second lactation. So a good colostrum management program is essential to ensure optimal immunization of your heifers. The second obstacle for young calves is that it takes time for the calf's own immune system to be fully mature. On the graph here, the horizontal axis at the bottom represents time, starting from the calf's birth, while the vertical axis shows the calf's antibody level for a specific virus, for example. Here we see the curve as the calf absorbs maternal antibodies by ingesting colostrum, and we see that maternal antibodies decay over time. At birth, the calf's immune system is functional but immature. We can see here the antibodies made by the calf, which takes time to develop. The red line here is a theoretical level, a level of antibodies in the blood that's protective against disease. At a certain point, the level of maternal antibodies becomes too low and the calf's immune system isn't fully mature enough to produce its own antibodies to combat disease. So there's a window of vulnerability here where the calf doesn't have enough of their own antibodies to fight off disease and doesn't have a protective level of maternal antibodies either. The third and final obstacle for the young calf's immune system we'll talk about today is rather complex, but it's an important concept of maternal antibody interference. Maternal antibodies, while extremely important, can actually interfere with the calf's ability to mount an effective immune response when given traditional injectable vaccines. Looking at the same graph as earlier, we have the level of maternal antibodies decaying over time, followed by the calf producing her own antibodies. Here, we have a different line from our other graphs. This is the level of antibodies in the blood that allows for immunization. When maternal antibodies are above this line, they can block or interfere with an injectable vaccine. And it's important to remember that we don't know exactly when maternal antibodies will be sufficiently low enough that we can give an injectable vaccine and have it be effective in the young calf. So to summarize the three challenges facing a young calf's immune system: 1, calves are born with an insufficient level of antibodies to protect them from disease, so it's essential that they receive colostrum. 2, the calf's immune system takes time to mature. And 3, maternal antibody levels can interfere with the calf's ability to mount an effective immune response when given traditional injectable vaccines. So how do we overcome these obstacles to immunization for healthy heifers? The answer is by focusing on local immunity. Let me explain in a little more detail about local or mucosal immunity. Respiratory viruses tend to attack the upper respiratory tract by entering and infecting a calf through the nostrils. So we have a better chance of preventing infection when we have an antibody response directly in the mucous membranes where viruses first enter the body. These antibodies produced locally are known as IgA, and local immunity provides a line of defense directly at the point of entry of the virus for a rapid and effective defense. Which brings us to Inforce 3. Inforce 3 is an intranasal vaccine which can be administered to calves to prevent respiratory disease caused by BRSV and as an aid in preventing respiratory disease caused by IBR and PI3. I'd like to discuss for a moment the results of a study showing the efficacy of Inforce 3 against BRSV. Remember, that's the most important viral pathogen in calf BRD. This study was conducted on calves with maternal antibodies, meaning that the calves had received colostrum at birth. What this study demonstrated was that the Inforce 3 vaccine, administered intranasally, provides protection against BRSV from a very young age, even in the presence of maternal antibodies. The study consisted of 30 dairy calves between 3 and 11 days of age. They were seropositive for BRSV, meaning they had received their colostrum and had maternal antibodies for BRSV circulating in their blood. 2 groups were vaccinated on what we call day 0. 15 calves received the Inforce 3 vaccine, which contains 3 modified live viruses, BRSV, IBR, and PI3, and 15 calves in the control group received a vaccine containing only IBR and PI3. 9 weeks after vaccination, all the calves were challenged or exposed to aerosolized BRSV. The virus was put in the air in a sealed room for 30 minutes to expose them all to BRSV. Here are some of the results of that study. On the graph in orange are the calves in the control group. So these calves were not vaccinated against BRSV. And in blue, we have the calves that received Enforce 3 containing the modified live virus protecting against BRSV. In the calves that had been vaccinated with Enforce 3, the percentage of lung lesions was significantly lower after the challenge with BRSV. Another finding was that mortality was reduced by 70% in the calves vaccinated with Enforce 3. In the control group, 10 out of the 15 calves died, while in the vaccinated group, 3 out of the 15 calves died. So the results of this study demonstrate that Enforce 3 provides effective protection against BRSV even in the presence of maternal antibodies. In addition to the reduction in mortality and reduced lung lesions, other findings of the study showed that calves vaccinated with Enforce 3 had lower clinical illness scores and increased lung function. For those of you who may not be familiar, I'll just go over how to administer Enforce 3 now. There are actually two options. The entire dose, 2 milliliters, can be administered in one nostril, or you can split the 2 mils and administer one in each nostril. You'll notice the white cannula that comes with the vaccine in the picture here. And again, this vaccine is effective even when maternal antibodies are present. And here are the instructions on how to reconstitute Enforce 3. There are 2 vials, one containing the freeze-dried vaccine in powder form and the other containing the sterile diluent. First, you draw up all the sterile diluent in the syringe, then inject it into the vial containing the freeze-dried vaccine. Then shake very gently until it's well mixed. And only use sterile syringes and needles. It's really important that you not re-sterilize the cannula, the needles, or syringe with any chemicals such as alcohol or bleach, as traces of these may inactivate the vaccine. Then transfer the 2 ml dose to the syringe. It's very important, obviously, to remove the needle and place the cannula onto the end of the syringe to administer the dose into the animal's nostril. Although you don't have to use the cannula provided, you can simply administer the dose directly using a syringe if you prefer that method. And here's an image of administration. The cannula is placed on the end of the syringe here, and the calf's head is held in a normal upright position. So you want the calf's nose pointed straight forwards, not tipped up towards the sky. So the cannula is inserted until the rounded tip presses against the nostril. It's inserted straight into the nostril along the floor of the nasal cavity, and the vaccine is administered. And as mentioned, you could administer with a syringe as well as the cannula, obviously, again, removing the needle before placing the syringe in the nostril. If you observe a small amount of nasal discharge after administering the vaccine, it's not a problem. When the vaccine comes into contact with the nasal mucous membrane, the calf is considered vaccinated, and the immune system starts working to produce the IgA antibodies, along with the protein called interferon, which helps neutralize viruses. So some nasal discharge after administration, especially if it's followed by a bit of a snort or a sneeze, is considered normal, and the vaccine will still have the desired effect. In terms of safety, in our safety studies, Enforce 3 was administered to many different groups of cattle, from newborn calves to cows in different stages of pregnancy to high-stress stocker cattle, and no adverse effects were noted in any of these groups. Enforce 3 is a safe vaccine for all of these categories of cattle. So here's a sample vaccination protocol. Of course, you need to ask your herd veterinarian what protocol would be most appropriate for your dairy herd. In this example, we administer the Enforce vaccine twice between birth and weaning, but this is certainly a discussion to have with your herd veterinarian. So the key points about Enforce 3 in young calves is that this vaccine is effective in the presence of maternal antibodies. It provides protective immunity while the young calf's immune system is still developing, and it provides immediate protection by stimulating a local response in the mucous membrane of the upper respiratory tract, right where respiratory viruses enter. So what should you take away from this talk? Well, BRD is an extremely costly disease in the dairy industry. The young calf's immune system has specific challenges that need to be considered when developing a plan for immunization, and after ingesting colostrum, Enforce 3 is the first vaccine that should be given to a calf to protect it against respiratory disease. So thank you very much for your attention today. If you have further questions about preventing respiratory disease in your dairy heifers, be sure to contact your herd veterinarian. On behalf of Zoetis Canada, thank you very much again for viewing this presentation.